If you are getting ready for your embryo transfer, it is so exciting. It's a culmination of so much work and you're about to try to conceive, but oh my gosh, it can be anxiety provoking. You know, what to expect, what should you do to prepare, what should you do that day, and a lot of questions about what can you do to make that embryo stick. Today, we're going to talk all about how to prepare for, what to know about your embryo transfer to help you maximize your chances for success. Stick around. Welcome to the Baby or Bust Fertility Podcast. I'm your host, Dr. Lora Shahine. I'm a double board certified OBGYN and reproductive endocrinologist doing embryo transfers for over 20 years. It is my favorite thing to do. It is the best procedure. I love my job. I have lots of different types of procedures, but man, that embryo transfer, that culmination of all of that work and actually watching the embryo come into the uterine cavity, that little flash, of that burst, we call it, where the little bubble, the air bubble comes into the cavity. I just feel fireworks every time. And I know how exciting this is for my patients. And I really want them to know what to expect on that day so that when they are there, they can actually experience the embryo transfer. So that's what I want you to take away from today's episode, is just learning what to expect so that when you have this magical procedure, you know what to expect and you can truly be there, be present, and enjoy the moment. The embryo transfer is a huge hurdle and culmination of your fertility journey. You worked so hard to get to that day, the shots, the appointments, the egg retrieval, the recovery, and it is finally time to do an embryo transfer and get pregnant. The embryo transfer is important, and I have a lot of resources, including my blog post on embryo transfers. Find that on my website at drlorashahine.com. I have lots of information on my Instagram account and my TikTok account. The embryo transfer is so important that I want you to have all the information that will help make it successful for you. You arrive at the clinic, you check in, you have been asked to come with a full bladder. So make sure you follow those directions. Having a full bladder really helps with the process. It not only makes the angle of the uterus and the cervix straighter, honestly, so that the transfer itself can be easier, but a full bladder also helps with visualization. So while the transfer is happening, there's an ultrasonographer holding the ultrasound on your abdomen so that we can see into the uterine cavity and make sure that that placement is perfect for you. And having a bladder that is full of liquid allows for perfect visualization. So follow directions, come with a full bladder. It really helps with the procedure. Another thing that you might have been given and talked to about is taking a relaxing medication like Valium in order to prepare for the embryo transfer. Now, taking Valium is theoretically supposed to help quiet bladder contractions and maybe quiet uterine contractions to help make the process easier for you. Studies have shown that taking Valium does not improve chances of success with the embryo transfer. However, the clinic may offer it to you and it might help. It is sometimes uncomfortable to have a really full bladder, and Valium really can decrease the bladder contractions that might happen with a full bladder. So I do think that sometimes it makes the procedure more comfortable for people. Just remember that if you do take Valium, you cannot drive yourself home from the procedure. So talk to your clinic about whether that's a standard part of their protocol. So you're in the room, you're undressed from the waist down, have a little sheet kind of covering you. Your support person or partner is typically in the room with you. It's really nice if you can have a partner there or a support person. And then in our clinic, now every clinic is going to be a little bit different, but in our clinic, when the patient's ready, the first person that they talk to is the embryologist. The embryologist comes in from the embryology lab, gives the patient a picture of the embryo and talks them through everything that the embryo has gone through or embryos have gone through, and quality and genetic testing, really answers questions from the embryologist's point of view and talks to the patients about their embryo. I say embryo a lot because 90% of our patients in my clinic transfer one embryo. So if you're transferring more than one, don't get confused, but I typically say embryo because we're typically transferring one. After the patient's questions are answered from the embryology standpoint, the ultrasonographer or the person who's going to hold the ultrasound during the procedure comes in and checks the bladder, because visualization is really important. So while you're lying down, an abdominal ultrasound is placed on your abdomen, and we're trying to make sure that the angle of the uterus is perfect and we can have really good visualization. And so you talk to the embryologist, the ultrasonographer says everything's okay, and then the doctor comes in, and that's the third person there: embryologist, ultrasonographer, and doctor. And the doctor walks through the procedure, answers any further questions, and then we get started. So the doctor places the speculum so we can see the cervix, a little bit of prep if we need to, but very gentle. And we can see really well with the ultrasound. And then the embryologist will come back and they'll bring a catheter. In my clinic, we do the 2-step embryo transfer technique where we actually place a prep catheter through the cervix. So we're not doing anything with the embryo until we know everything is ready. Some people have little kind of tricky paths and twists and turns in their cervix, and we want to figure that out and make sure everything's perfect before we actually have the embryo in the room and ready to be transferred. So the embryologist brings the prep catheter in, and the doctor will pass it through the cervix under ultrasound guidance. And then I will tell the embryologist, okay, we're good. Time to load that embryo because everything's ready. And the embryologist walks back into the embryology lab. We can still see them and we can see the incubator, but now everybody can also watch what the embryologist is seeing. We have a monitor in our transfer rooms that shows exactly into the microscope what the embryologist is seeing. So transparency is really important in my clinic. It's a value system at Pacific Northwest Fertility. And part of that is sharing this experience with the patients because it is magical. So we can all watch the embryologist load the embryo into the embryo catheter. And it's amazing. It's really highly magnified. It looks like a little rocket ship, this adorable little embryo just kind of going up into the catheter. We're all ready. I'm there waiting with the prep catheter. Everyone's excited. And the embryologist walks. Can you tell I love embryo transfers? I really do. The embryologist walks in with, now this catheter has the embryo at the tip. And I tell the patients, all the hard work has been done, right? Like I've literally rolled out the red carpet. That's the prep catheter for that embryo. And the embryologist is bringing the star of the show into the transfer room. And so all we have to do is gently thread the transfer catheter through the prep catheter that's already done all the work. And then when we're in the right spot, we just very gently press the catheter. It helps push the embryo into the uterine cavity with a little bit of media, a little bit of air bubbles to kind of help push through and visualize. And we can look on the ultrasound. You can see when the embryo transfer is happening, this little white flash, this little burst. That's when I feel like fireworks. And you're not actually seeing the embryo. The embryo is so small that you can't actually see it on the ultrasound. You're seeing these little air bubbles that helped push and kind of guide the embryo into where it needed to be. And so when that happens, we really should be all done. Both of the catheters are removed from the cervix and the uterine cavity gently. I give both of the catheters back to the embryologist. And there's one final step that we do. The embryologist walks back into the lab and looks under the microscope and really makes sure that the transfer is complete. Because embryos are so small, because we cannot see them on ultrasound, the embryologist will flush the catheters a little bit and really make sure that the embryo was transferred. Because if it happened to be stuck at the tip of the catheter, you want to know. And I tell patients, like, we just don't want to assume. And it doesn't happen that often. Every once in a while, we have an embryo that gets stuck at the tip of the catheter. And we say, oh, it's just a sticky embryo, no problem. And we just kind of go through the motions again. And again, double, triple check. And I will tell you, it only happens a couple of times a year, but almost always people get pregnant. And that's why we joke and we say it was a sticky embryo. So we're done. I bring the speculum out. I help the patient get nice and comfortable. We walk through what just happened. I answer any questions, and the embryo transfer is done. And it honestly could take all of that less than 5 minutes. And it's such a buildup. There's so much work that gets to that point. And then all of a sudden it's over. We're going to get back to talking more about the embryo transfer. I just want to remind you how important it is to support the show. Wherever you are listening, follow the show. That'll help you not miss our weekly episodes all about reproductive health, whether it's an interview with an expert in the field or an in-depth discussion like today, where I'm kind of really getting to a certain topic. Every week we publish, and I want you to make sure that you see that and you get that information. And so follow the show so you don't miss an episode. If you have a moment, review the show. A 5-star review with a little bit of information about why you think it's valuable helps other people find the show. And it is so helpful to us. Really appreciate it if you took that moment. Now, let's get back to learning more about embryo transfers. So things that can happen, sometimes it's a little bit difficult to see. Sometimes it's a little tricky to kind of get the catheter where it needs to go. But that's why we do this without the embryo in place. And we don't bring the embryo out of the incubator. We don't bring it into the room until everything's perfect and ready. And we just take our time. It's just, you just got to be patient. But the vast majority of the time, it is a very simple and wonderful and very exciting procedure. After the procedure, I talk to patients about kind of what to expect. What I tell everyone is, listen, we think implantation happens the day of the transfer, maybe the day after the transfer. So those are 2 great days to just pamper yourself and just take care of yourself. You cannot do anything wrong. There is so much on the internet about what you can and can't do after the embryo transfer. It'll drive you crazy. If you really think about it, people get pregnant all the time. And in this window, before they have a positive pregnancy test, they're not changing their activities. And people get pregnant, right? This is different. It's so precious. You've worked so hard to be there. You want to do everything right, but the embryo is amazing and it's going to find its right spot. When you sit up after the transfer, the embryo cannot fall out. When you go to the bathroom after the transfer, the embryo cannot fall out. You cannot do anything wrong. And I want you to pamper yourself. I want you to take good care of yourself, but I don't want to add to the mental gymnastics that is there. Now, you do not have to rest after the embryo transfer. And I know that out there are some clinics and some providers that want you to rest, 10, 20 minutes, 15 minutes after the procedure, and then get up and go to the bathroom. I've been doing this for so long. I remember we used to give patients bedpans after the transfer so that they wouldn't have to move and they could just relieve their bladder in a bedpan and then wait for the whatever 20 or 30 minutes that they had to go. It does not matter. There is a fantastic study published in Fertility and Sterility from 2013. I will link it into the information in this video. A randomized controlled trial where half of the patients just got up right after the procedure, went to the bathroom, went on about their day, and the other half of the patients rested for 10 minutes after the transfer before they could do anything. And the success rates were higher in the patients that got up right away and went to the bathroom. So it doesn't matter. If you want to rest and relax, talk to your team about it. If it makes you feel good, that's fantastic. But I don't want my patients just lying there on the table, trying to hold this full bladder and terrified about moving around, because it just doesn't make a difference. I want to reassure you. I had a wonderful attending, Dr. Amin Milky, when I did my fellowship in reproductive endocrinology and infertility at Stanford. He had this wonderful analogy. He loved to talk about food. And he said, listen, the uterus is like a bagel. So the 2 walls of the uterus are like a bagel. And the uterine lining, like the uterine cavity, the lining, the wall of the uterus is like cream cheese. Okay. And we literally just put the embryo as a raisin. We put the raisin in the cream cheese in the bagel. And when you stand up, that raisin is not going to fall out. And I know food is a funny analogy, but it really helped me visualize when I was learning. And it really has helped some patients that are just so nervous about standing up. The uterine cavity is not like this, empty space or this hole that an embryo can like roll around like a ping pong ball. It is literally, it's a potential space, but the walls of the uterus are together and we're just placing an embryo where it needs to be. So the human body is amazing. Talk to your team about their post-embryo instructions. And if they want you to relax for a few minutes, if they recommend certain things, then follow those directions from your clinic in your personal experience. I am telling you what I tell my patients and the reassurance that I want to provide them. I hope you found today's episode valuable. The embryo transfer is so special, and I want you to have an incredible experience and enjoy the moment. I hope you learned a lot today. You can find this episode and all others on my website, drlorashahine.com, along with other links to valuable content, books I've written, my blog, links to Instagram and TikTok, and of course, all the content that I have on YouTube. I really like educating, and I know people learn in different ways. So there's lots of different ways to find valuable information and education on your reproductive health at my website, drlorashahine.com. Thank you to my wonderful team at Audiotocracy for producing the show. Thank you for being here today and joining us for the Baby or Bust Fertility podcast. I'm your host, Dr. Lora Shahine, and until next week, wishing you love, luck, and pineapples.